So that's a retrospective analysis that has been produced by the Lymphoma Working Party of the EBMT, and that wanted to analyze clinical characteristics of the patients, characteristics of the stem cell transplantation procedure, as well as the long-term outcome of patients with diffuse large B-cell lymphoma, with primary refractory disease or with relapsed disease that had been treated with an autologous or an allogeneic stem cell transplantation and had been reported to the EBMT lymphoma database. And we wanted to analyze patients that had been transplanted between 1990 and December 2019, so a few number of years. We were able to identify around 5,400 patients. 4,000 of them had been treated with an autologous stem cell transplantation. Around 1,000 of them had been treated with an allogeneic stem cell transplantation. If we focus on the clinical characteristics and the long-term outcome of patients that were treated with an autologous stem cell transplantation, looking at different time periods during this period of time where the retrospective analysis took place, we have to mention that in the last few years we have been autografting and more or an older population of patients, that the time interval between diagnosis and transplant has been progressively shorter over time. Performance status of the patients being taken into the autologous stem cell transplantation procedure, better peripheral blood stem cells are basically the most frequently used nowadays to autograft our patients. And we have basically abandoned total body radiation in the consolidation strategies for these patients. If we look at the long-term outcome of patients being treated with autologous stem cell transplantation, the 3 years overall survival has significantly improved over time, and we have also been able to significantly reduce non-relapse mortality of these patients also over time. So looking at these 1,000 or so patients that had been treated with an allogeneic stem cell transplantation between 1990 and 2019, we have to mention that allotransplant as the first transplant has progressively decreased over time. The patients that we are allografting are also significantly older in the last few years, as we have seen for autologous stem cell transplantation. Time interval between diagnosis and allogeneic stem cell transplant has become progressively shorter. Peripheral blood has become the universal source of stem cells for transplantation. We have increased the number of patients being allografted using the reduced intensity conditioning protocol. We have also increased the number of patients being allografted using haploidentical donors and match unrelated donors. And if we look at the long-term outcome of patients being allografted, the 3 years overall survival and progression-free survival have improved over time, and we have also been able to reduce non-relapse mortality over time. So basically, the conclusion of this retrospective analysis is that the clinical features of patients being transplanted because of diffuse large B-cell lymphoma have changed over time. We have been able to improve basically overall survival in both autologous stem cell transplantation and allotransplant recipients. Non-relapse mortality has significantly decreased over time. Relapse rate is still a major issue for both auto and allogeneic stem cell transplantation recipients. And in this retrospective analysis, we have not been able to look at the potential impact of the introduction of CAR T cells in patients with diffuse large B-cell lymphoma, basically because the cutoff point was December 2019, and CAR T cells were introduced only a few years ago in Europe.